Doc, it's my sacroiliac. It hurts so much. It's in my tuchus. Boy, I've heard that so many times in my office. They get the sacroiliac pain, they come to me, they go to a chiropractor, they get adjusted, and then they go, and then I sat down, and then I got in the car, and then, oh, there it was again. And it just is this cycle that just keeps happening. I want to stop that cycle, and I've got something exciting to stop it with.
Hello, I am Massimo. I was a right-handed pitcher. I was reaching speeds up to 91 miles an hour. Late November of 2022, I started having deep SI joint pain, and it kind of plagued me fast. My senior season was coming up, and this was the most important year. 3 months of SI joint pain, been to 2 different chiropractors, nothing was helping. I would get adjustments, and then 2 days later, once I would throw, it would immediately start hurting again. And then come March of 2023, my insurance stopped covering those chiropractor visits. So I decided to come to Dr. Fields, where I actually wanted to go.
What this thing does on here is it goes in and it sends low energy focus shockwaves. Focus, very important, because it's like a blade of sound, and it can go right in to that sacroiliac joint and start ping-ponging around. And what it does, it'll break up scar tissue if needed. It'll stimulate something called angiogenesis, which is new blood vessel proliferation, new collagen, and actually get rid of chronic inflammation. The joint starts to mobilize, right? And then you go to the chiropractor, you get adjusted, and now it stays mobile. It is because you're not in or out. This is a dynamic thing. The spine is dynamic. It needs to move, adapt, improvise, overcome.
So the Piezowave actually was a very interesting experience for me the first time. First, they put some heated gel on my back, kind of just to help. I'm not really sure there. But once the wand was like kind of placed on the different points of my back, you could tell where you were really hurting and where you weren't. Like the feedback was instantaneous. Like when the wand was on a certain spot that you were hurting, you would know and you would feel it. Like it definitely was hurting a little bit, but after it immediately like started feeling better. 4 weeks of that, and I was like already better. I started pitching in games again. I was throwing harder, and towards the end of the season, after I think like 8 visits, I reached my max speed of 91 miles an hour.
Let's look at some of the research. Biological mechanism of shockwave in bone. ESWT promotes tissue regeneration, wound healing, angiogenesis, bone remodeling. That's when people have arthritis and the subchondral bone gets all wonky and uneven, and it actually helps remodel it and create a nice smooth bone again. In fact, one study showed a 50% reduction in bone spurs. Quite amazing. How about some decreased inflammation and tissue regeneration in your SI joints? That's what I'm talking about. And they go on. ESWT is a non-invasive therapeutic modality with effectiveness, convenience, and safety. ESWT can replace surgery with no surgical risks in many orthopedic disorders. The complication rates are low and negligible. Piezowave, how about no complications? More good news on this tech and your SI joints. Extracorporeal shockwave therapy for sacroiliac pain, a prospective, randomized, sham-controlled, short-term trial. Here we go. In the ESWT group, numeric rating scale for pain decreased significantly at post-treatment week 4 compared to baseline. In the sham group, the numeric rating scale for pain did not differ at any post-treatment time point. In other words, ESWT helps SI joints feel better. But doc, what if I have arthritis in my sacroiliac joints? Well, let's see about that. Extracorporeal shockwave for the treatment of osteoarthritis. Shockwave therapy had significant improvement of both pain reduction and functional improvement. That means people could be active again, compared with placebo, corticosteroid, hyaluronic acid, medication, and ultrasound groups. A significant difference between ESWT and PRP, which is hot right now, platelet-rich plasma, was observed in pain reduction. So they both showed great results. Now, pair the PRP with the shockwave therapy, and now you have this synergistic effect that is incredible for SI joints. But we don't always have that available. So this can be a wonderful stand-alone treatment for osteoarthritis in the sacroiliac joints. Osteoarthritis is a loss of joint space because of cartilage degeneration. We can help regenerate the cartilage. It's bone spurs. We can reduce the bone spurs. And it is subchondral sclerosis, which is undulating bone underneath the cartilage. And we can actually help that bone also.
Once I started coming to Dr. Fields, through many different techniques, especially the Piezowave, just completely fixed my back. I was out for the first half of the season of my senior year, but once I started coming here, I would come 2 days a week, and every time I would come here, it would get better.
So a great thing about this Piezowave is that I can set this by the 0.5 centimeter to go at a very prescribed depth into your sacroiliac joint and accomplish what I need to accomplish. If it's a ligament on the outer part of the SI joint, we can target that. If it's deep in the SI joint, we can target that. And so I'd like to crank back time on your sacroiliac joints and give you a life again. Because if you're standing and you have pain, you're arching back and you have pain, it's putting pressure on that SI joint. Let's free that up again.